okay?
Can you see
us? Yes, I can. I'm sorry that we weren't able to join you for this presentation. So I'm Thea Mounts. I'm the SAC Director for Washington State. And for our project, we've been working with our Office of Crime Victims Advocacy, which is located at the Washington State Department of Commerce. We've been working with Nikki Gleason, who's the Victims of Crime Section Manager. And within the SAC, Leah Fisher, who works for me, has been doing the bulk of the work for the project. Unfortunately, the timing was not good. She is actually somewhere on the Mediterranean enjoying her honeymoon on a cruise, so she's probably not thinking about this at all. So can you go to the next slide, please? So just a quick overview of what we've been trying to do with our project. We had two main goals. One was to take a look at the funded initiatives that Commerce already has been funding and working with to see how effective they are and whether they're meeting their service goals. And then also along with that, look at the feasibility of identifying a post-service data collection tool to help them look at outcomes. The Department of Commerce a number of years ago had a survey that they had each of their programs administer to clients as they finished up the services they were receiving, but they weren't, the survey itself was not providing much information that was useful. So we were, as part of this project, hoping to help them find maybe a better tool to get at those outcomes. And then the second goal was to look at service delivery gaps within the state. So using data from NIBRS and InfoNet, which is the Department of Commerce's data collection tool, and comparing where we're seeing the need based off the NIBRS data in comparison to where the services are being provided, developing some recommendations based off of the gaps that we're seeing, and then actually looking at some alternative data sources to track service delivery gaps in the future. So can you go to the next slide? Can you move to the next slide? Oh, that's okay.
Fighting with me a little bit here.
Oh, okay. And actually, you can just go to, because they're just header slides. So starting with our goal 1 and the first initiative, you can go to the next slide, and then actually the next slide after that. In order to collect the information about what the programs were planning to do and whether they're meeting their goals, we actually administered a survey that was completed by the grant managers at the Department of Commerce. So the grant managers were asked to complete one survey for each of the programs that they're working with, and they were asked, and we did this through SurveyMonkey, asked to indicate what the objectives were for each of the programs, whether they were making progress on each objective, if they were having difficulties, what types of difficulties they were having in meeting their goals. And then we also had some questions about communication with the program office. We wanted to know whether the programs themselves were communicating well with the Department of Commerce around the funding. So then the next slide, please. So just an overview of a couple of the results. This is just whether or not the programs were meeting the objectives as identified in their grant materials. And so for the main objectives, almost half were meeting the objectives at the time of the survey. Some of these programs had just started the funding, so there would be some that were trailing and not maybe as further along in the program implementation as expected. There are some that have status unknown, so we will, in the final report, look a little bit more as to who was in those buckets. And then we looked at the information across each of the objectives that was listed within the survey. So then the next slide, please. and then just looking at how the programs were communicating with the grant managers. You can see that there are a few that were communicating weekly, about a quarter monthly, a quarter quarterly, and then a little less than a third were as needed. And then whether or not they were responsive to a request for information from the grant managers, about half were always responsive, another little over a third were usually, and then it's good to see that zero were never, although the rarely is a little problematic, but that's a fairly small percentage. So then the next, so then another piece of looking at the programs, we wanted to dig in a little deeper with a subset of the programs. And so we decided to incorporate some site visits into our project. And so Leah went out to 7 groups and conducted semi-structured interviews to determine how the initiatives operate, whether there were barriers to initiative implementation, and what factors were leading to success. And so what we tried to do is pick a variety of programs. So we have a mix of programs that are in urban and rural areas, eastern and western Washington. We included 2 tribal programs, and we've got 1 CASA, we've got a SANE program. If you go to the next slide, please. If you're familiar with the geography of Washington State, this is where the site visits occurred. We're in Olympia, Washington, which is in Thurston County. King County is where Seattle is, so we visited a couple of programs up there. And then the rural part of the state, southeastern Washington, we visited 3 programs over there for the in-depth visits. And then, can you please go to the next slide? So taking all of that information, we tried to boil it down to themes around factors that led to program success, and then I'll get to those that really were impeding program success. And so the first and fourth bullet on this slide are somewhat related. So really, some of the programs mentioned that you know, the support of the community was really a factor in the success of their program. So for example, one program improved its accessibility because there's a local taxi company that helps people get to the shelters for free. So that was really a plus for that program, and they felt that they were better able to serve people in the community because of that resource. And then for one of the other programs, the Domestic Violence Services of Benton and Franklin counties, they mentioned that if their program had any need for anything to run the program, if they needed a new printer or a new computer or whatever it was, the community would get together and provide that resource. So to them, that was a real boon to their program success. And then we have volunteers on here. That's pretty self-explanatory. And then the mobile advocacy was another one that really a lot of the programs mentioned as something that was helping them provide their services better. So the ability to be out of the office and in the community, they wouldn't necessarily have to be at the main office or the shelter. They could be out doing advocacy work if they had laptops and cell phones. And then for there was one program that mentioned that providing the staff with cell phone a work cell phone gave the clients better opportunity to reach someone in the program because they could give them that cell phone number and have conversations as they felt they needed to for the services. So then the next slide, please. So then some of the factors that were impeding program success, the lack of community readiness was mentioned by one program. So this was a program where the community itself didn't really want to come to terms with high rates of sexual crime and abuse in the community, so there was some denial going on. And so the program itself felt like they weren't getting the support from the community to be able to provide the services as they felt were necessary. And then another one, of course, is lack of volunteers. That's self-explanatory, and lack of staffing. A fourth item was limits on the use of funding. So some of the programs felt that they had need for certain things for running the program, but because of the limitations put on both the VOCA funding as well as some other types of funding that they were receiving, they couldn't actually use those funds to fill those needs. So that was a problem for a couple of programs. And then the training needs, some programs felt that they really needed to have additional training around how to better serve clients, and then also how actually for the staff themselves, how to care for their own mental health needs. So there's a high rate of burnout among a lot of these programs among the staff. So having the staff be better able to cope with their self-care and their mental health needs was something that was mentioned. And so we'll take these factors and turn them into some recommendations that we will then put into our report back to the Department of Commerce. The next slide, please. And then also something that we hadn't quite realized being fairly new to this area was the wide variety of programs that are being funded through the VOCA funds in Washington State. So we at first had thought, well, we would be able to maybe identify one post-survey, a data collection instrument that would serve everyone's needs for looking at post-service outcomes, but very quickly realized that that was unrealistic. So for this project, we're going to identify a series of post-service data collection instruments so that they target different types of programs. So something, for example, for domestic violence programs, something maybe that's for the SANE programs, so that it better meets the objectives or matches the objectives of the programs. So then the next slide, please. And the next slide, please. So this is Goal 2 that we're working on. I don't have any results to show for our Goal 2 yet. We are in the process of analyzing the data from NIBRS and InfoNet. So we've received data from both of those data sources, and we're in the process of coding and putting together analyses that would be analogous to what Iowa is doing, so that we can identify those areas of the state where it seems like there is a gap between the need and the service deliveries. And the next slide. So nothing to report yet then for recommendations either. So then the last piece are those alternative data sources that we're looking at. So the first one is the Washington Emergency Management Service Information System. So this is the data collection system for all of those 911 calls. And in looking at the data submission guide for that program, it looked like there were some data elements in there that might get at some things like whether the call was the result of a domestic violence incident or some other assault. And so what we wanted to do with this piece of the project is to just evaluate whether that whether WMSIS could potentially be useful in the future. And so we've had a little trouble with and our Department of Health actually runs this program. We had trouble getting them to agree to actually sending us the data itself. They feel like the system is not very mature and they're working a lot on data quality, but what they have sent us is some high-level aggregate data, so we'll be able to assess whether those fields that we're most interested in have enough data and are complete enough to actually maybe in the future do an analysis with the data to look at service gaps. The second piece, the second data source we're looking at is the Comprehensive Hospital Abstract Reporting System. This is hospital discharge data. This data would only be valuable for those most severe cases where there's an injury that resulted in hospitalization. We have used this in the past and compared it to crime data, And so we'll be doing that again. We'll also be taking a look at our all-peer claims database in the state. So that's a system that collects up all of the health claims for people living in Washington. So it would capture not only those people who are hospitalized, but those people who may have gone to an emergency room, doctor's office for services. And so we're looking to see whether there's enough information in there to identify whether injuries were, again, the result of an assault or a domestic violence, sexual assault, and so forth. And then the final data source I have listed on here is from the Victim Compensation Program, which is run out of our, Department of Licensing. No, is that right? No. Labor and Industries program. Sorry, I've forgotten now which agency, but they actually pay for the SANE exams in the state. So we were going to explore whether or not there's enough information in there to get a better handle on the sexual assaults in the state. So we are in the process of finalizing a data sharing agreement, and then as soon as that's signed, they said they could send over the data. And so we will be examining that information, and our hope is to be able to include it into the final report. If we don't get to it in time, we will continue that analysis once our project for the with JRSA is over. So then on the last slide, just any questions?
All right, thank you.
Thank you, Dia.
Washington had a really ambitious plan, and it sounds like you're making a lot of progress. And I, for one, can hardly wait to find out about those other data sets that you're exploring. I know BJS will be interested too, especially since they've been trying to look at hospital data and what that says for victimization rates. So that's great. We have a couple minutes for any questions for Tia from Washington or for the Iowa team.
I have a question about it. So for your, I noticed you had broken out looking at services to the white and non-white. Were you able to cut out what non-white is?
We could if we wanted to dig further into it. We obviously PNT reporting just to the certain.
And would that also include
That would be just race.
Okay.
I have a couple questions or comments. This might be the only chance I have to do it. I was curious, so one of the things like that Leah just brought up was having some difficulty accessing some data. And I was just curious, amongst all the projects that are represented in the room, if any of the SACs had any kind of difficulty in accessing data sets, criminal justice information. What you described in Iowa, you've got such a perfect situation there, but sometimes difficulties in access arise, and I just was curious if any of those kind of problems were things that you encountered in your particular projects, if that question makes sense.
Mm-hmm.
Well, we work extensively a lot with PNP data, and like CSR, for example, one of the things that OCBS wanted to look at was funding allocations instead of by project year, by grant year. So when you pull financial data out, it comes out of an Excel sheet. And one of the things that's frustrating working with that data, not necessarily getting it, but getting it in a usable format, is the export will tell you, okay, this project's funded out of the following grant years, like 2 or 3 grant years. So, there's not an easy way to understand in the export the amount of money that's coming out of the different pots. So you actually have to go in manually and get everything in appropriated in the export, right? Because otherwise you got to go in and say, okay, well these are the 20 projects or 30 projects that are funded out of 2 or more grant years. You got to pull the funding application. It's not like a 50-50 so if you really want to get into the weeds and understand, are we hitting our 10% money allocation in the following categories within a grant year? You've got to get into the system and know that data. So, I mean, there are little things like that. There are quality issues, some checks and some of the SAR stuff. Not necessarily getting the data, but just in terms of getting it in workable and usable format. Yes, we're struggling with
I have a question also. I was struck, Sarah, you mentioned like the size of your SAC or your resources, and I was curious. Actually, what I want to do is if we could just really quickly go around to, I guess we have 7 SACs that are involved. Hawaii wasn't partnering with SACs, but if the SAC representative could just mention what the size of your SAC is, because I'm kind of curious about whether there's variation in the resources. And what I'm hoping some of the answers will reflect that an awful lot of good work could be done regardless of the size or capacity of the SAC that's there. I hope that if you'll indulge me with that, I'd be interested.
Yeah, Thea, we'll start with you. So how many staff members do you have in your SAC?
So I have 4 and then a partial FTE in the SAC, but I'm able to take advantage. I also supervise a group of health researchers, so I'm able to, for some of the health data sources, take advantage of their expertise, so I'm cheating a little bit.
Okay, great, thanks. Will, for Wisconsin?
Yeah, we have a director, and so we have the UCR side of the house, and with uniform crime reports, and there are a bunch of staff members that are that. There's a supervisor over there, and there's an analyst and a part-time, and 2 analysts and a part-time person. And then we have a bunch of different programs, such as all KIT initiative with the SAC grant, with some public health stuff that I work on. VOCA-SAC, that's I would say 6 total. But there are a lot of projects that are spread out.
Yeah.
Okay. So we are 6 total, including myself, but we also just recently hired 2 new people, so 84 is one of those applications.
Minnesota?
Oh,
Yeah.
sorry.
just the 2. 2 for Minnesota.
2? That's it, 2? Oh, okay. And Maine?
Like, for instance, in my case, I'm not part of that. I was tasked with my analysis and analyze some of the projects, but I still my FTE. And there's a lot of staff, so I don't even know.
Okay. There's surrounding resources that can be accessed and used. Okay. Vermont?
Yeah, so there's 3 of us, my executive director, researcher, myself, I just got an image and thank you for getting me out of it.
Oh, you're welcome.
And maybe just repeat that one.
Yeah, and we have a capability to house 5 we actually have 2 sets of staff that we employ and hiring additional next month.
Great.
Thank you. It's interesting to me anyway, so I appreciate it. Thank you very much.